Thank you.
And a good-looking guy too, right?
Good-looking guy.
Great face for radio.
Yeah.
Because radio's on video now too.
That's exactly right.
Oh, well, all right. So the camera's cut all that. That's good. It's recording 100%. Oh, thank God.
Phenomenal.
Phenomenon. We've had
Phenomena.
Dr. Pepper commercial. Remember it.
we had a couple of like technical difficulties.
Yeah, but this was the first one that we just completely tackled from the beginning.
Yeah,
That's what guys do.
that's what guys do.
We tackle things from the beginning.
We fix things.
Oh, thank God.
And we drink beer.
I was about to be so fucking pissed.
Lawrence.
Red Stripe.
Hello.
Hooray, beer.
Hello, lover.
This episode brought to you by...
Red Stripe. Wow, you guys want to get started?
Let's get started.
Hell yeah.
Let's do it.
As you know, I do a song for every guest. For some reason, I picked this one for you. It's badass. It's from Mission Impossible 2. We all love it.
Nothing is impossible.
Nothing, exactly. Nothing is impossible.
Amen.
We got a very special guest today, Dr. David Kurland.
MD, PhD.
Doctor.
Dr. David Kurland.
Double Dr. David.
This should be my theme song, I think.
It's a sick theme song.
When you walk into the operating room, glove me.
Friend, spatula.
I'm about to tickle something in your brain.
But they won't be able to feel it, right?
No.
Exactly. You can operate on brains, they don't feel it.
Yeah, the brain doesn't have its own nerve endings.
Oh, which is insane.
It is insane.
And you can keep elaborating on that.
Surgery awake.
Yeah, I remember Ted Kennedy, the doctor, the senator or whatever, they had to do brain surgery on him. And they're like, yeah, he's awake when they do it.
Yeah.
Because like you need to know if like something happens, I guess.
It depends where the pathology is. If it's typically right-handed people have their function predominantly on the left side of the brain, like important functions like language, things like that. So if there's a tumor or something in near an important area, often do it awake.
Wait, so a lefty's brain would be different?
More often than not.
Oh, wow.
Yeah.
I never knew that.
Yeah. So the left side of the brain controls the right side of the body, and vice versa. But most people are right-handed. So, and even in most lefties, language is on the left side. So if there's pathology on the left side, there's an option to do things awake.
Oh, wow.
Yeah, pretty well.
Yeah, it is crazy. Anyway, so Dr. Dave, you're actually the first father to ever appear on the show. First person with a kid to ever come on.
I'm honored. I don't know what that says about you guys, but
it means that we're headed in the right direction. We're getting more diverse.
More mature.
We're getting more mature.
We're friends with the right people.
Yes.
We're friends with the right people.
We're getting serious about this. That's what it means.
Yeah.
Anyway, you studied at Washington University in St. Louis, and then you went to medical school at the University of Maryland, and now you're currently a resident neurosurgeon at NYU?
Yep.
Is that the right terminology to say?
Yeah.
So I guess, yeah.
Indentured servant is
Indentured servant?
another term we use often.
I learned about that in social studies class. So what made you get into neurosurgery? Being a neurosurgeon?
Yeah. So I originally wanted to, being a doctor, first of all, like any good Jewish boy, I had a mom asking me questions like, can you stand the sight of blood? And I was like, yeah, I think so. And my 7-year-old self, yeah, I think so. And she was like, well, you owe it to society.
Yeah, you do.
To be a neurosurgeon, you owe it to society.
So she pretty much guilted you into becoming a doctor.
Yeah, pretty much. But I had proclivities towards like math and science. But I originally wanted to be like an orthopod.
So orthopedics, would that be bones?
Bones, yeah.
You want to be a bone doctor?
Bone doctor. I worked with somebody in high school in my area doing some, I just saw some very cool stuff. People filleted open and bones cracking. And I kind of never, I was, turned towards it at such a young age. I never really processed like why it was interesting to me. It just, it was always, it never kind of faltered, that interest. And then I, went through the pre-med track in college and just, decided to go to med school. But I had a very fortuitous, meeting with a neurosurgeon in med school my first year, and I ended up doing research with him over the summer and switching into the MD PhD program and falling in love with neurosurgery. So that was kind of the track there. Just, you kind of get awed by certain things that you see. For a lot of us, it's like watching an aneurysm clipping. It's
fuck. That's like my biggest fear is like having an aneurysm.
Yeah.
Like, because you don't really see it. It's not like everyone has access to tests that can be like, oh, you're someone who's prone to having an aneurysm.
Yeah, it doesn't really. I mean, there's certain syndromes that you can follow in families, that kind of thing. But yeah, there's like just a handful of risk factors, like smoking and high blood pressure, are like the big ones. But yeah, I'd say most people who have an aneurysm never have a problem. We often find them incidentally, but they can kind of get problematic. And definitely, if one bursts, it's bad.
Yeah, dude, that's literally one of my biggest fears. Just because I kind of knew someone who like randomly had one, and it like the after effects were like their life completely changed. Speech is kind of like gone for now. They don't move well.
Yeah, like a ruptured aneurysm. Then?
Yeah. So like you said, like blood pressure is like a obvious sign of them. But you said a lot of people don't have a problem before. Is it people who don't go to the doctor and get their blood pressure checked, or?
I think so. Blood pressure, it's kind of weird. The aneurysms form at branch points in blood vessels at areas of turbulent flow. So, it's like excess force against a wall causes a weakening thing. So it's people with really high blood pressure who have aneurysms. We like to get that under control because it's like a risk factor of rupture. I don't know that it's totally clear that it's the major cause.
I got what you're saying.
But it's associated for sure. Smoking is like one of the only ones.
So people
I'm not
can
sure
have an
vaping
aneurysm.
is though. That's the thing.
Oh yeah.
I mean, it's going to be very interesting when we look forward 20, 30 years. We would expect a decrease in the incidence of aneurysm formation because of all public health effort to reduce smoking. And now everyone's vaping.
Yeah, because who knows if it's like the nicotine or what it is about the cigarettes that make that happen. So what type of patients do you like most typically work with?
So we see everything from kind of head to sacrum. We deal with trauma, head trauma, brain tumors, aneurysms, other kind of vascular issues. We operate on people with Parkinson's. We do deep brain stimulation for weird things like Parkinson's, OCD, epilepsy. And we do everything for the spine, deformity, tumors, decompressions, herniated discs, that kind of stuff.
Oh, so a neurosurgeon works with spines as well?
Yeah, I think about 70-80% of patients coming to a general neurosurgeon's clinic probably have a spine complaint.
Is it because like the nerves going down, like connected to the brain?
Yeah, I mean, these days there's not much difference between like an orthopedic surgeon practicing spine and a spinal neurosurgeon. They all kind of have to fit through the same eye of the needle, getting through training. But in general, neurosurgeons tend to be a little bit more comfortable, what we call like intradural, like tumors and things like that. Anytime you have to deal with nerves or the spinal cord, and orthopedic surgeons are oftentimes a little more comfortable with deformity, bony work, that kind of stuff, cracking bones, realigning them.
I feel you. So as like a neurosurgeon, like, are you hyper aware of like what's happening with your brain, or like, say you're feeling a certain way, or like say you eat a certain thing or do a certain thing? Are you like, oh, this is going to do this to me? Because like you probably know a lot of stuff.
I would say absolutely not.
No.
I mean, I probably am. If I stop and think, I'm like, I could probably think about how this affects me, but I don't do that on a regular basis. I wish I did. I'd probably eat a lot better and exercise more. That'd be.
But you don't have any time to do that.
No.
There's no time for that. You can't treat yourself. I mean, as a resident, you're not allowed to eat or sleep.
No sleep or eating?
Not really.
That's why I didn't do it.
I'm wearing a diaper right now.
Yeah. He's wearing a diaper and he's on call. So
how often, like how many hours a day are you on call?
26, 27 hours.
The time is all perceptive. He just has more of it. That
No, it depends. These days, life is much better. I just started my 5th year of 7. And the first 4 are kind of brutal at times, and this year's nice. I'm on a research year, kind of pushing forward a few projects, which is nice. A little bit more free time.
Do you have like a certain like project you're most passionate about?
Right now, I'm doing something pretty cool. I don't know how much I'm supposed to talk about this.
That's up to you.
Live.
Don't say anything.
No, we're looking at. There's a technology called that salvages blood from a surgery. It's collected and processed and given back to the patient to kind of try to avoid blood transfusions.
Oh, nice.
Yeah, so we're looking at the quality of of the stuff that comes out of that machine. It's not really been studied well in spine surgery.
Is there like a shortage of blood out there? Like, you know, that they need
Sometimes.
people donating a lot?
Right now, there's a shortage of contrast.
What does that mean?
For like,
Yeah,
no, it's Fran, explain.
Oh no,
You've been quiet.
it's just I'm just listening. It's a great
Yeah,
conversation.
get it. Hop in.
No. I mean, everything is really dependent on supply chain. And believe it or not, the medical industry is suffering.
What is contrast?
Contrast is basically dye that they use to
X-rays and stuff?
Yeah, so
not
it's
X-rays. It's used in contention.
Yeah, it's like a dense material that you put in the veins, and it lights up blood vessels on an X-ray or a CAT scan, and it will linger a little bit in certain pathologies. If there's a tumor that's highly vascular, it'll show up, in the tumor, and you're like, oh, there's the tumor.
Helps identify problems.
Yeah. And so there's that. There's a different kind of contrast that's given for an MRI, but same thing. But for CT scans right now, it's like Omnipaque, I think it's called, is a national shortage.
The fuck, this supply chain bullshit.
Yeah,
Did it all start from that boat that got stuck?
Oh no, and
That's like just like a
what was it? What canal was that? Suez
Canal problem?
Yeah, but no, I don't think so.
Yeah, I think a lot of our problems
Start
from the Suez Canal. Yeah.
Started from that
that
boat.
damn canal.
Yeah,
It's probably my least favorite canal.
even in what we do. So I do most of the spinal stuff with Dave.
Oh yeah, you guys work together. That's it. We should have cleared that
Yeah.
up. I know Dave through Fran.
I work for Dave.
Yes.
is what it is. I work for Dave. Dave is my boss. But even in the stuff that we put in spines, big companies, $billion companies are really strapped for inventory, and it's insane to watch because we wind up having to, what is that saying? Rob Peter to pay Paul. Paul and Peter got into a fight, and one can't pay the other. Cool.
You got it.
Yeah. So I wind up, having to go into other parts of my company or territories that are also doing the same kind of business, and having to ask these people for their inventory, and then they're backstocked on their inventory. So it's a nightmare. It's a mess, and it's sad because the only person that loses is really the patient at the end of the day. It's like,
for sure.
It's interesting because in like most implants are some kind of rare metals involved, right?
Oh, I'm
Like
sure.
It used to be steel.
your implants are titanium, aluminum, vanadium, TAV, TAV.
What about silicone implants?
Cobalt.
There's some
Cobalt
there,
chrome.
there's silicon. Yeah, there's silicon on some
I've heard of
things.
those.
Yeah.
Yo, Dave, do you want to just pull a little closer and like tilt it up a little bit? I just feel like,
The audience has got to hear me.
exactly. They got to hear you.
Lean in, as they say.
Yeah, they lean
there
in
you
a
go.
tiny bit.
Or lean
I
back.
lean. Yeah. Feel free to mess with it. You're not gonna break it. As Fran said, that
Perfect.
stuff's not expensive.
No.
All right, so I feel like everyone always talks about like going through med school, pre-med, and now you're getting your PhD.
No, he's got his PhD.
You got your PhD. You're
Yeah.
a doctor.
Working on my
already.
rabbit.
He's doctor. He's
So
going.
now you're going through your residency.
Bunch of
residency.
non-Jews not even.
So how many
laughing
years
at
does that take in like? So how many years is that? And like how? Like tell me like the process of like undergrad, med school, blah 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 blah. I
Yeah.
mess up all the terms.
Yeah, no.
How much time do you have?
walk the people through the process. Now, I feel like that. So we had a great conversation with an actor the other day, Yosef Kuznetsov. And he walked us through his just like day in a life, and it was actually very similar to what we do, what you do, in terms of like how tedious it is to just get to the show, and then once you get to the show, you think you've made it at the end when you become a resident, you've matched, you think and then it's like, oh, shit, I got to do like 7 more years of just waiting.
Yeah, damn.
Yeah, a lot of waiting. So it all starts in kindergarten.
Yeah, seriously.
Yeah, I mean it's so, 4 years of high school, where do we start counting? But most people do 4 years of undergrad.
Yes.
Yeah.
Okay?
Yeah.
That's what I did. And then typically 4 years of med school. Some people take a year off for research these days. It's like the Ponzi scheme of medical education is
So much
a whole
school.
other story, by the way. Like people are constantly tacking on more and more years to their education
Why do you think
to
that
become
is?
more competitive, to get into the
Yeah, that's probably
most
why.
competitive places for whatever they want to do. So it's extremely common now for people to take off a year during med school just to do research and get a bunch of publications. So then you have people like me who did a PhD. So I think 9 years of med school plus grad school.
Damn.
So that's what we're up to 13.
Damn. Of college.
Yeah. And I took a year off after college. I didn't even tell you that.
What'd you do?
I worked at the NIH for a year doing research.
What's the NIH?
With Dr.
National
Fauci.
Institutes of Health. Yeah. Fauci.
Were you
I was his second.
involved in
Did you know
gain of
Fauci?
I know Fauci pretty well.
Dr. Fauci?
Were you involved in gain of function research?
No. No, actually, I worked in a very cool institute there, the Human Genome Research Institute. And when I was there, they started this thing called the Undiagnosed Diseases Program. It was like a Dr. House kind of thing.
Oh, cool.
Yeah, it was pretty wild. I did nothing productive there. After that, it's funny that I ended up doing a PhD because I wrote off research. I never, ever want to be in a lab again.
You just want to be in the operating room?
I wanted to just get on with my life, I think.
Yeah.
So I had mentioned I kind of fell into a project the summer after my first year of med school, doing the thing that everybody does. They don't just go on vacation. They try to pad their CV a little bit. So I thought I had an inkling, in the brain. I kind of gravitated towards neuroanatomy and neuroscience courses. So I flew with the project that summer, and my mentor saw that I was really loving it, and he encouraged me to take additional time off, to really pursue it. And during that year, I switched into the MD PhD program, which at many schools is a formalized combined program. They try to get you out between 7 and 8 years. So because I'm an overachiever, I did 9. So they typically a PhD just through grad schools can be 5 to 8, 9 years in and of itself. So they try to condense it for you, so you're not kind of stuck in school for so long. So that's what I did, and then I picked the single longest residency.
Why is it the long? Because it's neuro.
So there's a lot of pathology that's within neurosurgery. From kind of brain and spine, there's a lot, and it's constantly evolving. It used to be you would enter and do a year or two of general surgery, and then X number of years in neurosurgery. So once they started formalizing a neurosurgical pathway to training, just kind of all coalesced. Some programs were still 1 year of general surgery, 6 years of neurosurgery, and then all programs now are straight 7 years. And then most people are doing fellowships now. If you want to stay within academia or get a competitive job, so we're talking 8 years of post med school training.
School. So
Yeah.
right now you're not taking classes.
I'm not taking classes.
You're just I don't exactly explain what a residency
So
is.
it's
Sorry.
Trial by fire, learning on the job. I mean, you're day one of residency, you're kind of put into a job that you are not told anything about in med school. It's the things you need to know first day as a doctor have almost little to do with taking care of patients. It's navigating a health system. How do you place orders? What's important? How do you kind of progress people through their hospital stay? That's the job you're given as an intern. It's not do surgery.
I hope not.
It's not take care of this complicated ICU patient. It's you have the rest of the team is doing the fun stuff, and you're okay. This is the
Like a lot of other jobs.
Yeah. So you're kind of learning the ropes. Varying degrees of training wheels are on you. There's a lot of really good support that you have getting through it, but you kind of, the way we do it at least, you're gradually promoted through the system, and you begin to operate very early on, and that's the fun thing and the scary and hard thing about any kind of surgical residency, is because you've got to combine the medical knowledge with the doing of surgery. So it's the technical know-how. You can be amazing with your hands, but if you don't know when to apply it, you're kind of...
And vice versa. Yeah. You could know exactly what to do, what every part of the brain is, but if you're not that good with your hands, fuck.
Yeah.
So have you operated on a brain before?
Yeah.
Damn. What was that like?
I still have my training wheels on, unfortunately. No, it's scary. It's fun, and you know, when you're given a little bit more leeway and a little bit more autonomy, it's really rewarding, but it's really terrifying.
Oh, I'm sure there's so much. Like, that's got to be one of the types of surgeons with the most pressure on them.
Yeah.
Yeah.
But you'd be it's also really surprising how comfortable you can get too.
Yeah?
Yeah.
Do you put on like music? I've seen in movies like they'll put on like music in the operating room and like throw in the AirPods.
No one puts on AirPods.
No, I think I saw that. That was probably Dr. House.
Yeah.
I used to watch that show.
No, but it depends what kind of style the attending has, and some let you pick the music, or some say no, I want a quiet operating theater, and it depends. Like I don't think it's bad to have music. I start to think about like what's my OR going to be.
I'd say, wait, what are you going to be like?
I might be somebody who lets my trainee or assistant pick things. For me, it's like a team aspect.
And you're okay with either?
No music or...
No, I'm saying, it's not a big problem to you. So if your team's more comfortable with music, you're down for that.
Yeah, and I think actually most of the people in the room, Frank can maybe speak to this too, it's the folks that tend to want a quiet operating room often are like doing, the very complicated things under the microscope, and that makes sense.
Yeah.
And then when you're doing something that's not lower complexity, but more of a team sport, it's fun to have a little bit of background noise. It's not thumping.
Yeah. Fran's not DJing in there.
Sometimes.
You actually DJ?
Yeah.
I love that.
But it is nice, and it kind of relaxes the group that's in there, because we sometimes have like, I don't know, like a dozen people in the room.
Yeah.
And if everyone's quiet, it's kind of uncomfortable.
Yeah,
I agree with that.
There's this like unnecessary amount of pressure in an operating room that's quiet. And when there's only one person that's giving the directive, like an attending surgeon who's 20, 30 years older than everybody else in the room, it becomes a little intimidating. And you don't want... You think the focus is on you and not the patient. And when there's music playing in the room, like Dave said, it feels like everyone's on the same page. And then Dave, makes his own playlists, and there's other guys that make their own playlists. They pop those playlists on, and it's usually music that like everybody just fucking jams out to.
Girls just want to have fun.
Like girls just absolutely
could be on there.
Absolutely. But like, likes the same shit that we like to listen to.
Yeah, it's not like Mozart playing.
No.
Though we do have one attending. I'm not sure if he'll tune into this, but he plays some like Latin jazz, and that can be fun sometimes.
Hey, he better be tuning in.
Demo.
I knew that was Demo.
I love that. So the TV shows aren't full of shit when they do that.
No. The only thing that's full of shit, and it could just be at a hospital I've never been to before, but I have never seen people up in the rafters watching surgery.
Oh, I think I've seen that.
I think like a relic of the past.
That is,
when you're literally being in an auditorium and everyone's wearing like outdoor clothes, they just roll their sleeves up and dig in.
Yeah. And everybody in the stands are wearing like curly wigs.
What's your favorite doctor show or movie?
Ooh, that's a good one. I've seen every House.
I used to watch House.
House was great.
Remember the Lyme disease one?
It's always sarcoidosis.
Yeah.
Sarcoid.
That show was legit.
Let's see. I feel like I watched like 6 seasons of Grey's Anatomy. I'm really outing myself here.
There was like 16 of those, so at least you didn't go all the way.
Yeah. And then a little bit of Private Practice. You got to mix that in.
Did you watch The Resident?
No. Oh, but I watched a little bit of New Amsterdam because we work at Bellevue, which is cool. They filmed there.
Yeah.
Oh, wow.
Yeah.
ER? Was that George Clooney?
Yeah, I've never seen.
That may have been before our time.
The ER, but yeah, that's Clooney. That's my time.
Yeah.
Yeah. Off the air, we discussed ages. I'm not gonna.
You're a young guy. You came to my party.
You're a fun guy.
Yeah, I'm a fun guy. He's a young guy.
I'm a guy.
He's just a guy.
I'm just a guy.
A member of the space.
I'm the co-host.
Just a DJ sometimes.
Yeah, exactly. DJ sometimes.
Yeah. So wait a minute. I was just looking at the weird questions I have. So I don't know. You have
Should we turn the AC on for the tough questions?
You want to turn the AC on?
Yeah. Yeah.
They've been hotboxing me in here.
Excuse me.
Excuse me. Excuse me. Ah, yes.
There we go.
I've been big into loafers these days.
Those are nice.
Loaf Daddy. Oh, those are new ones.
Yeah. A little flag on the side.
They're like $150, and they're so comfortable.
Oh, what a steal.
What a steal! What a steal! Yeah, I try to keep it casual.
Have you guys shopped on that website Shein?
I looked at it once. I heard it's terrible quality.
Terrible quality.
The
What's
worst.
Shein?
Terrible quality.
They did the swastika design and they got canceled, kind of.
They did a swastika
Oh, really?
design.
A swastika necklace, I think.
Really?
Yeah.
Why would they do that?
They thought it
I'm
meant
very
something
torn
else.
here because I got one of these Shein hordes, like a
bundle,
like these TikTokers will do, and you spend like $50 and you get about 1,000 items.
Yeah, that's
and they're
actually
all
not
made
bad.
out of like plastic or something, but some of them look nice.
No, they do. I was on their website and I was about to, I had like a full cart and I was like, wait a minute.
Yeah.
Why is this $10?
Swastika necklace. I'm not too sure about that.
They definitely did do that. But what about like the long-term use of Adderall?
Great question.
As a neurosurgeon, what do you think about that?
So, yeah. Disclaimer, first of all. What do you call it? When they fake your head. This is a deep fake.
Deep fake. This is not
And I'm
Dr.
a
Dave.
robot. And the real human, David Kurland, cannot be held accountable for anything that's said.
Yeah, 100%. Steve, just show no one's held accountable for what they say. besides me.
It's so interesting. So, like, what's Adderall? Like,
It's methamphetamine kind of, right?
It's amphetamine. What's amphetamine? Like, on the street.
Cocaine and meth, crystal meth.
Yeah. So it's always so interesting to me that we're prescribing controlled doses of something that ruins lives.
Oh yeah, illegal ass shit.
Yeah.
I don't know. Like there certainly are long-term effects. I mean, I know I have many friends who, try to, kick Adderall. They're done with their like rigorous, like planned out academic life, and they're at a job that they might find like satisfaction in, and all of a sudden, that orients them to being present and not needing that kind of thing. But people have a hard time coming off of it, or they take it, for certain projects that they have to do. So I don't know the literature on it, but I'm sure that it's the chronic use of anything that is the problem. Whether it's something you're taking as a medication, whether it's an antidepressant, whether it's something for ADD, your brain undergoes changes. I don't think it's a single use of anything. That's name one thing that automatically ruins your life.
Drugs. Yeah. Oh yeah.
No.
You're saying with one try?
Yeah, with a single. I mean, I'm being kind of facetious here, but I can't really think of anything that, taken in a controlled manner, ruins your life in one go.
I can't think of anything.
I think it's the chronic use of anything, whether that's like a controlled substance, whether that's something that's prescribed to you. So I don't know. I'm sure smart people out there know.
Yeah.
I'm sure it's been studied.
I'll tell you this. I have ADD, ADHD, and I took Adderall growing up, and I stopped for a while, and then I got this, this current job that I have, and I take it. I take it a lot. I take it every day, but I also will stop for like a month, because after taking it for maybe 3-4 months straight, I get tired. Where I feel like I need to catch up, and I can't catch up if I keep taking it.
It like loses its effect on you.
It loses its effect, and then cognitively too, I have this like fog that I can't shake, and that if I don't take the Adderall, then it's significant. That brain fog is significantly worse. So at that point, it's like, okay, maybe you need to just like wean yourself off a little bit, take a little break, and then come back to it when you feel that you need it again. But it's really, really, really hard to do, because your body is definitely dependent on it at one point.
And at some point, you're like, man, my job kind of is. You're just like, I need to be as attentive as possible at work. So if I don't take it,
Right.
That's a lot of pressure.
It's a stimulant too,
Right. And who knows what that does?
Overdrive.
And who knows to your DNA, to chromosomes, to.
So the interesting thing about like going back to like SSRIs for depression. Do you guys know like?
I know what that is.
Do you know when it takes effect? Is
no.
It like
a couple weeks after you start.
Yeah, it takes a while.
Yeah.
Like I think it increases serotonin. That's what's weird about like certain.
So if I took an antidepressant right now, it wouldn't have its effect on me tonight.
No, but I believe your serotonin levels will actually be measurably elevated. But the effects on your mood, it's because the brain chemistry is like a network. There's so many things at play. So many neurotransmitters that are in balance. A lot of it's dependent on, what proteins are there, and I'm like what receptors are available to respond to a certain neurotransmitter. And sometimes the more stimulation you give to a certain like pathway, like it's like almost like dominoes. That's how I kind of think about gene transcription and things like that. You kick off a certain pathway enough, it strengthens that pathway, or it can downregulate it. So it takes time. It takes time for these things to take effect. Whether that's addiction, whether that's something positive like improving your mood.
Even like vitamins, and I know creatine, like vitamins you gotta take for like 30 days before they have like your body can really start using them. And creatine, you have to have like a loading period of like a couple weeks where like you're taking a lot until it has its effect on you. So I guess it makes sense with the body in general.
Yeah, it's funny with vitamins. I think almost uniformly, healthy people. I think it's been shown like on population-based studies. Certain vitamins, first of all, I think are predispose you to certain illnesses and diseases.
Really?
Or I think it's like like death by any cause is associated with like vitamin intake.
So you're saying
weird?
What you're
That
kind of
is
saying is
weird.
like it's not that healthy to take vitamins?
Or you just don't need to.
I've heard that
these days.
I've heard the multivitamins are all bullshit.
Yeah, but I think vitamin D is one that has very good evidence base.
Vitamin D, zinc, B12. There's only a few, but magnesium, I don't even know. That's a mineral, I guess. But yeah, I heard a lot of the multivitamins are bullshit. I'll sometimes take them, pee out Mountain Dew, but like,
Sure.
Yeah, that's when you know that
Got
they're
to.
working.
Yeah.
Yeah.
But all right, so I don't know if you know, but we just got a new sponsor. It's a non-alcoholic beverage called Goldies. Fran, you want to grab those?
What?
May I?
You're kidding me.
Are you thirsty?
I am thirsty.
Are you famished?
I am famished.
Then we've got the drink
Do you like wet mouth?
So I guess like a question I have for you is like, and again, if you don't know this, there's no pressure.
Yeah.
So you're not held accountable for anything. But
cucumber?
I'll take an orange one. Yuzu spritz.
Yuzu spritz.
Ooh. I don't know. Will you guys like the
I-
yuzu spritz?
I prefer the
Yeah, a little
yuzu,
spritz.
but they're both good. I've had them both.
I'll do a cucumber. I'll be different.
Yeah,
I'll be different. Cucumber me.
cucumber this guy. So I guess one of the questions is like, what's your brain like on alcohol? Like getting blacked out?
So, alcohol is interesting. I mean, I didn't study this.
Yeah.
I'm-
100%.
Despite doing a PhD in neuroscience, I didn't study any of this. I studied microglia.
Microglia.
Yeah. Look it up.
There's no microglia in Goldies, I don't think.
I don't think so. It's very expensive.
It kind of tastes like there's alcohol in there, right?
Yeah. Totally.
There's none.
Cucumber super tonic. I think it's the tonic. It harkens to
I used to
alcohol.
think gin tastes like that, but I guess that's the tonic part of it.
Wow.
Yeah. Goldies, baby.
That's what I said too when I first looked
It's
at
nice.
I've been cutting down on my binge
Are these
drinking.
crafted in NYC?
Brooklyn Cannery.
You're kidding me.
Yeah.
it. Yeah,
Right in Gowanus, where Fran used to live.
that's right. I used to ride the dolphins in the Gowanus Canal to work every day.
Yeah.
Drinking in Goldies.
Oh, it says crafted in NYC. That's why you said it. I was like,
He could tell by the texture on the can.
dude, this one's fucking good.
Yeah, the yuzu. You want to try the yuzu?
Sure.
Yeah, you guys.
Pass this over to Dave.
Yeah, you got gold. The thing about Goldies is you can share. Yeah. Unlike Dr. Pepper.
You're gonna have to cut out this portion where we're sharing drinks. My roommate wouldn't approve.
Just don't put your mouth on it.
Ooh, that's nice.
Isn't that pretty good?
Isn't it, dude, that's
Yeah.
some fucking
It's funny,
tasty
the
shit.
cucumber one, I feel like this is alcoholic.
100%.
Yeah.
The guy who founded it, so he's like one of our friends. he says he'll be having like parties and people will be drinking it and they think they're drinking alcohol.
Yeah.
And they're almost
drunk.
Like placebo, baby.
All right, let me tell you about whatever we were talking about. So you asked about what's it like to be blacked out.
No, I know what it's. I mean, I actually don't. I've actually never fully blacked out.
Really?
Yeah. So
Fran?
something that doesn't
How many
happen to me.
times?
Oh man,
11,000?
once or twice. Once or twice.
I plead the fifth. No, so alcohol is similar to like Xanax and how it and where it acts on your body, but it's also weird because it can be quite addictive too. From like what I understand about it. So it's like a depressant, you know, despite people going out and getting wild.
You're getting happy with it.
Yeah. So my understanding of blacking out is it just shuts down. It's like such a negative stimulation. It's kind of a oxymoron, but you know, it puts so much negative pressure on your like temporal lobes, where your hippocampus lies, that you literally are like not forming new memories. It's like so much that you're just shut down the ability to form new memories.
Oh wow,
That makes sense. That's why you forget them.
Yeah.
Wow.
So you know, I've seen people who are like the next day they're like, man, I have no idea what happened, but you can still appear to be with it. You don't have to be the belligerent, you know, drunk person to be experiencing that, I think. But I think that's my conception of what's really going on when you're blacked out.
It just shuts off part of your brain.
Yeah, but the question is that is a single time doing that, you know, really harmful? I don't know. I don't know the answer to that.
When I heard in school they told us that if you black out once, that it makes it way easier for it to happen to your brain again.
I have no idea if that's true.
My school told me that.
Sounds like a bunch of malarkey.
Yeah.
Sounds like malarkey to me too. Who told you that?
It was campus safety.
You for blacking out?
No, but not because I blacked out, because we had like a can of beer in our room and they found it.
Yeah. No, I truthfully don't know, but I don't know of any other, you know, thing in chemistry or like neuroscience that functions that way. Like maybe it's easier, but I don't think it's like 100 times easier.
Yes.
Maybe it's like
it's how you open up a new passageway that's like you have a beer and now you're like, what the fuck?
It's kind of like what I was saying. It maybe strengthens, you know, the relationship between something. But I think it's the chronicity of things. I think that really becomes problematic.
Yeah.
Yeah. I mean, Fran, like he's sitting here having a real conversation, and he's blacked out once or twice. He said,
Yeah, exactly.
Exactly.
He turned out
and
real
I
good.
think I'm doing just
Yeah.
fine.
That's not to you know
Condone getting
give a
blacked
standard
out.
proof.
Yeah.
But the truth is, I don't know. You know, if some unsuspecting, you know, person drinks too much and is worried about that, I don't know that you need to be necessarily if you live the rest of your life in a healthy, respectful manner.
Yeah, 100%.
Are physicians starting to get away from prescribing pain medications to patients, and like how has that been received over the past couple of years and changing that, going off of how, you know, addictive it is and everything?
Yeah, it's really interesting because what was that?
Dope sick?
Yeah, dope sick. So it all kind of dawned on me because I've spent so long in the medical education process, like how that has evolved during my time being educated.
Oh yeah.
I remember in the show they show the talking points in the sales training, and it's like pain is the whatever vital, you know, fifth vital sign or whatever. And it wasn't shopped to the med students in that manner, but it trickled down to us for sure, where we had lectures on pain and how it's really important to treat pain. And we also had the talking point of they're not as addictive or problematic if you're treating pain.
Yeah.
Which
was a lie.
It's true in some sense. It's true in an acute period, but it was being, you know, talked about more of a subacute to chronic kind of situation where if someone has real pain that you're treating, then that's not a problem for someone to get addicted.
Got you.
Or it's less of a problem. And I think that now we're seeing that was utter bullshit. And it's interesting because now it's not a full 180, but I think we've been more honest with ourselves. And especially now training, every year we have to do like an opioid prescribing little module, an online thing to just refresh just the knowledge base about these kinds of things. But in the hospital, I think we're a bit more free with it, and I think that's appropriate. Someone with acute post-surgical pain, perfect candidate. It's very good at these things. Are very good at treating.
They got an IV.
IV or oral, depending on the situation. And then now we have, teams of pain specialists that, help people address pain from a multimodal perspective. Like there are things that are really good for pain, like something called Toradol. It's like a cousin of ibuprofen.
The NFL players were given that.
It's great. I've had it once or twice, and it's great. It's like a really strong NSAID, and you don't get high from it.
Oh, really?
No, it's like taking ibuprofen or Aleve.
But like, say you're injured,
powerful.
It helps. Like, say you're injured and like you take it, you're not going to feel that pain, and you're going to go all out, and it could potentially. I'm talking in terms of NFL player.
Yeah, and what was that movie? Not Friday Night Lights. I'm blanking. Where the guy's getting like cortisone shots in the locker room.
Any Given Sunday?
No, it was like a high school. Varsity Blues.
Yeah.
So for sure, I think that's problematic for certain things.
But there's certainly a use for painkillers, of course.
But it's interesting. I just going back, there's definitely been a big about face, with how we're being educated, and it's really, really interesting to be present for that. And it got kind of meta for me when I was watching Dope Sick.
Yeah. There was I don't know if we were talking about this a couple of days ago. Or we were talking about it, but we noticed that maybe I was watching a documentary. I don't know, but the good drugs that were marketed as good 20 years ago, and the bad drugs that were marketed as bad 20 years ago, are now starting to flip.
Like marijuana versus
marijuana,
painkillers?
psilocybin, all these.
That's
types
kind of crazy, actually.
Did you guys read that book, How to Change Your Mind?
No, but our friend did, who we were just with.
Yeah.
It's great.
Yeah. And
this show sponsored by How to Change Your Mind. No, it's very interesting. How things are spun by politics, religious opinion,
for sure,
and instances where things blow up for like kooky people trying to promote something. That was I think a big thing with a lot of the psychedelics, is that the people who were promoting it were in the beginning, that's what I learned from the book, in the beginning were quite academic about it.
Very.
And then the people who began to really popularize it for, in the beginning, legitimate things went off the deep end a little bit. And
hippies, kind of?
Yeah, I mean, and people who kind of had developed a cult following and became larger than the original mission of whatever they were doing. So then it became a public health and a national, soapbox kind of, grandstanding about certain issues.
The Reagan era, get all the drugs off the streets.
So it is very interesting to see where things are going. I mean, getting ads now about like guided ketamine sessions.
Yeah,
that's crazy.
On Instagram, like things like that.
What?
Yeah.
Although I've heard there's benefits for like depression or something with ketamine.
Yeah, and what's also crazy is that like when I was doing my PhD, this is like stuff we used to anesthetize rats, just like sitting in a locked cabinet, used every day.
You just put the drugs in them?
Yeah.
Wow.
In the rats, yeah. They'll put it to do our experiments. You can cut that. Sorry, Peter.
Yeah.
So we use ketamine. I don't use it, but so it's used in very specific situations in pain management, where people will be placed on a ketamine drip, and who knows how it works, but maybe you get these people with these. There's something called complex regional pain syndrome. I think that's actually kind of where I've seen it used before. But you send someone into like a kind of mystical like situation, and they emerge. Maybe feeling differently about their perception of pain.
Whether it's emotional or physical pain.
Yeah, I don't know if that's what's happening in the hospital, how we use it now, but that's, I think, how people are trying to investigate these uses. And things like, I mean, I'm just learning this from reading the book. I'm not like...
it's not on the job.
Yeah, I didn't study this. I don't have any like major practical experience with this stuff, but you know, it's really cool to, you know, be more aware of the ongoing research, and it's cool to see that it's in the public eye now.
Yeah,
I think more people are interested in, like you said, I think enough time has elapsed where people are reapproaching the same questions and are being allowed to study things in a controlled setting.
Right.
And there's big money now as well, is what I understand.
Oh yeah, for sure. Yeah, there's a bunch of companies like I see like penny stocks like psilocybin and stuff. They're like, oh, these are good investments because, you know, the technology's changing. Yeah, like psychedelics. Like when we were in high school, we were told like you're going to see unicorns and stuff. It's not like, from what I understand, there's nothing like that.
Yeah, no, I mean, I haven't experienced anybody that has had like a life altering or life changing moment in a negative way from any of these things that you know are, you know,
like seeing demons
contrary to you know, popular like media or whatever like that. And it's insane. It's insane to watch. It's insane to see things now grow in this age of information. I mean, like we talk about it, but there's thousands of other. Joe Rogan talks about it. There's so many people that are now talking about it.
And I believe you're now the number 2 podcast on Spotify, right?
Number 2 on Spotify, number 1 on Apple Podcasts. Yes. Yeah.
The one thing that's interesting to me about, you know, these, you know, psychedelics, I don't know what to lump in there, but you don't hear about people being addicted to those things.
No, almost never.
And I wonder if it's just the duration of action. They didn't really talk about this in the book, but you know, the things that tend to be the most addictive are the high peak and the crash kind of things.
That's a good point.
I think a lot of these things are they're like long experiences for people. They're very meaningful, and then I think there's like I've never heard of anybody like going on a mushrooms bender.
No.
Yeah.
You know?
Yeah.
Like, where'd you go? It's like, just back from.
And like they keep wanting to do more. Like,
it's like I went to a Dead concert and like pulled up a lawn chair.
Yeah.
It's sure. It's almost like people are ready for it to be over when it's done, and then they're like, I'll revisit this later, rather than being like, I need this to function.
Yeah. So I don't know if that means they're safe. I mean, it's also, you know, getting things back to a research setting, I think allows smarter approaches to therapeutic things like dosing. Like somebody eating a pile of mushrooms
could turn out terribly.
Yeah. Versus, you know, some measured dose of something. That could be where, you know, problems have arisen in the past, or people having, you know, bad trips.
Oh, I imagine people. Yeah, there's someone who took way too much. Something terrible happened. The story gets out. Shrooms are making people kill themselves. 100%.
Yeah, there's definitely positives and negatives to.
Oh yeah, there's definitely like exactly. I feel like it's going a little bit in the direction of like this stuff is so good. When in reality, like if you do too much of literally anything, but especially drugs, it's going to end up terribly.
Yeah, it's funny, we were talking about that before. I think it's the chronicity of things, and that's what I think is unique about these, you know, things that are kind of making its way into society again, is because I don't think it seems to be promoting chronic use. But yeah.
Interesting. Very interesting. What does Dr. Dave see himself doing after he graduates from NYU residency and getting on?
2 years from now?
3 more years.
3 more years.
I'm doing fellowship actually at Brown.
Oh my goodness, bro.
Yeah.
Schoolboy.
What do I see myself doing? So I'm specializing in spine. I might have one more child by then.
There we go. Simon will get another sibling.
Simon
says one more child.
I don't know. My in-laws are in Boston. There's some statistic. I don't know if this is like nonsense, but I've heard that neurosurgeons predominantly live within 50 miles of their in-laws.
Oh wow!
So if I'm a betting man,
Of their in-laws. Interesting.
Yeah.
That's
I'd say the greater Boston area.
That's a great.
That's where I'll be living.
I feel it's a great area for a doctor.
Yeah.
Just go live on the Cape, man. Go open up a practice in Nantucket.
Yeah.
How many spine surgeons are in Nantucket?
I don't know. They need one.
We should find that out.
I googled for the show because I had a feeling.
Because I'll go be your spine rep out there.
I feel like a lot of people.
We can go get turkey terrifics after every case. You ever have one of those?
No,
dude.
I've been in Nantucket one time after my wedding.
The turkey. Have you had a turkey terrific?
Never been in Nantucket.
The turf. So first of all, you get the Nantucket apple juice, obviously, but then you order this. I forget what the place is called. I'll figure it out. But the sandwich is called the turkey terrific, and it's nice thick cut sliced turkey, and then you got
a lot of turkeys on Nantucket.
I don't know.
Gobble gobble.
Maybe. Probably. Every couple of blocks, you know. There's a what do you call a group of turkeys? I don't even know. A squad.
I forgot. There's a
gaggle of geese.
A gaggle of geese.
That's probably what I was thinking of.
Anyway,
murder of turkeys.
Turkey sandwich. It's rye bread. It's delicious bread, and then you have stuffing. And then you have like a cranberry sauce.
Oh, it's a Thanksgiving Day sandwich,
but
bro.
It's so good.
It took you 5 minutes to explain a Thanksgiving Day sandwich.
I didn't know what it was until I ate it. It was so delicious, and I'm happy about it.
God damn.
I wanted to give you the full
Is
experience.
it like a smear of cranberry, or is it like a thick, like straight out of the can?
It's like it's like a drizzle. Yeah.
I love those
like
type of sandwiches.
Yeah.
I love those. But back to your in-laws thing, like I feel like a lot of dudes end up having to move where their wives' families are. My brothers are basically in like where their wives' families are. See it happening a lot.
I'm okay with that. Okay with that, honey.
Where'd you grow up,
babe?
Baltimore.
Oh fuck yeah! We obviously we went to school in Baltimore.
Yeah.
Oh nice. So we got a big connection.
Loyola, right?
Loyola, yeah.
Go Hounds.
Greyhounds.
Yep.
G-Hounds, yeah.
So yeah,
I feel like Boston's a good city to move to. Why not? My dad's from there, so
it's a great city.
Yeah.
Historic.
Very academic.
But it's funny. I think like it just when you have a kid, it changes the way you see things. With living in New York without any family or help around, it's really nice to have just people
who love your kid like it's their own.
Yeah.
Yeah. Oh yeah. So I always hear like something changes when you have a kid. Did you experience that? I assume you did.
Yeah, I mean it's you can't often like hearken to what that is.
It's all personal.
Yeah, I mean it's just great. Like every moment is just great.
Yeah.
Even when he's misbehaving, it's very funny. I mean,
go to your room. I love you more.
He's like counting a little bit right now, and he can count to 2.
There we go.
And he doesn't have words for everything, so it'll be like to this, to this. He's adorable. He's the best. And it's I picked him up from daycare today, and there's like a little like captain's window. You can like peep into the room, and I just watch him play. It's kind of cool. He hasn't sinned enough to malign me
That's
yet.
true.
So like you just have like this gush of love for this little man.
Yeah, what is
running
he,
around.
1 or 2 years old?
He is. We speak in months.
Oh wow!
Yeah.
Oh wow! Nice.
He's almost 21 months.
Oh,
We're actually talking to
he's
another
a
of
very
our
young baby.
parent couples at the playground yesterday. When is it normal to stop talking in months?
I agree. I think earlier than 21, but maybe not. I think 16 maybe.
Somebody said that they asked him, like his kid was like under the age of 1, and he's like, "How old is your kid?" 0.
yeah,
Yeah, it's true. Yeah, you got to give something.
It hasn't happened yet.
0.
Yeah, he's still 0. I'm gonna do that. That's what I'm gonna do. Yeah, he's still 0.
How many months old are you, Fran?
I am.
It's hard to calculate, actually.
Yeah, I have no idea.
Yeah, well, fuck. There's when you get in your 20s, it gets
I'm
tough.
30 times
312.
Yeah.
3,148 months. Damn.
Whoa! Was I off by an order of magnitude?
No, I wasn't. Even
Holy
close.
moly!
I'm not even close.
Your p-value was.
Wait, was
I think you're 420 months
math.
plus.
Good stuff.
You're probably 429 months or something.
429 months. That sounds
Damn.
about right.
Yeah.
I'm happy with that.
Yeah.
Can it be
Wait,
400?
that's not right.
Can it be 460?
12
now?
times
30.
30. I think I was right.
What's 12 times 30? It's tough
I was off by a 0, I think.
It's tough to do math on the podcast.
Yeah.
Because you're like, for some reason, we can never do math on the podcast.
It's because there's too many lights. But no, 12 times 30 is 300. It's because there's
Goldies, because there's no alcohol in here.
If we were boozing, we'd be able to calculate anything.
I'm blacked out. This tonic.
Oh, wow, you're 360 months old. Well, you were on your birthday, so.
Hey, let the record show that the doctor
Dr.
got
D?
the math right.
I would hope so.
Well, it's 36, guys. 12 times.
Yeah, it's 360 was when you were on your birthday.
3. Add a 0. Is that really how many months old I am? It's not. That's not 12. That many months old. I feel like 360 months is not a lot more.
No, it doesn't sound like a lot at all.
A lot more than 21 months or whatever.
Yeah. Yeah,
I could repeat that a lot, like 30 times. Easy.
Yeah, that's like not that many more. Yeah. He'll get there.
What do you think is the best age to become a dad?
So I always wanted to be a young father, which is funny because now I miss my 20s.
Yeah, I'm sure.
I don't know. It depends what kind of relationship you're in, where you are. I mean, I can tell you, like, I don't know how people have like many kids in New York. I think if you're living in suburbia, 30.
Be fruitful, multiply.
Yeah, 30 seems good. What else is going on?
Yeah, if you're not in the city, if you're completely settled down, why not? But like, there's no way I'm having a kid in 4 months. You know what I mean? Like, I'm about to be 30, not ready.
Mazel tov.
I would definitely rise to the occasion.
Sure.
Were you nervous that you would not be able to rise to the occasion?
To be a dad?
Yeah.
No.
I feel like you're a doctor. Why? Like, if you could do that, you could be a dad.
No, but my biggest fear was not being like present. I'm someone who has like blinders on at times, so like I can my wife can attest to this. Like I'll be just like next to her, and she'll ask me a question, and I'm just like, or I'm like thinking about something else, or in the middle of a conversation. It's like my mind's always running 1,000 miles a second. So, and then also just the rigors of residency. That was my biggest concern, is just being around, because in the past, people, like I was saying, people are adding on more and more years to their education, and people are entering the toughest time of their medical training during their reproductive years, and they're delaying reproducing. And in the past, that was the norm. Like some of my attendings were like, I refused to get married until I finished training. And it's, I think, hard to do that if you're with somebody that you love and you want to, do these things. Oh, for sure. So, I didn't think that was for me, doing all that, delaying for, something that's ultimately like really rewarding.
Yeah, if you know you're going to marry, there's no point of waiting until you, fully finish. As long as they're willing to stay with you until that point.
Yeah.
Which is, why not?
I think I love that. I relate to that. Yeah. I relate to that.
What? Like settling down before you reach like that point?
Yeah, I mean, just like being wanting to be present.
Yeah.
I mean,
of course,
yeah. I feel like that's like a very big thing on everyone, anyone who wants to be a good father. You know what I mean?
Good relationship with anybody, you got to be present.
Yeah, it's hard.
And it's tough. It's tough when you have a demanding job, and it's tough when you are responsible for more people than just your family. It's like it's a real responsibility.
Friendships are really hard. Residency. Like,
I'm sure.
I will come out of the OR and have like 70 text messages in addition to like 100 messages about things that are going on with patients and things like that. And it's like I've missed, an entire day's worth of laughter with a group of friends.
Yeah.
And it's like, okay, I don't even know what to say, but like LOL, or I'll like reply to something like 10 hours old. It's like,
that's
hey, we're over
tough,
that.
Actually.
Yeah.
So that's hard. And people build relationships at work a lot. I've noticed, like Fran and I, super copacetic.
Yeah, he talks about you literally all the time.
We basically just met, compared to our, other people in our lives.
Yeah.
Yeah, but he literally is always talking about Dr. Dave.
And I love this kid.
Yeah, he works with a million Daves. I don't know if you know that. Yeah.
We do. We're going to work a lot with each other, I think, as the time goes on here. But it's my job is obviously not his, but we put a lot of hours in. And Steve is part of one of my groups of friends from college, and it's hard. It's really, really, really hard to.
He always leaves the friend group at the group chat.
Always. Yeah, because I it's just like I'm not paying attention to the meme you made earlier. I'm just not. I don't care.
Yeah.
I don't care about that meme. And you know what? It's really fucking bothering me.
No, it's hard because I don't know if you're the same way, but like I regret that, like when I then have time to have processed being part of that, I'm like, man, like I missed out. And like we have a family, like my wife's family, we have like a group chat, like like her parents, her sister, my brother-in-law who was in my fraternity in college, by the way.
Oh, that's sick.
Yeah, so
that is cool.
Got my frat brother as my brother-in-law.
That helps. That's like a friend for life.
That. Yeah.
Yeah.
Oh, I would love that.
But it's like a pretty active channel, and I just unmuted it, actually, because I was like I like miss out on stuff, and I had just like processed that I was not happy with like not being a part of it. I was like the one who like responded the least or like chimed in the least, and it's like I think we can do things that are difficult despite being really busy and spread thin to force ourselves to kind of be present.
Yeah, because you could reply and it takes a second. Like I'm pretty good at working and just being like, fuck it, I don't give a fuck what I said, but like they like it.
And it's I think harder on you to be pissed off about pulling your attention somewhere.
Yeah, for sure.
It's like that weighs on people, I think.
Yeah. Because then they might take it like, what are we saying? Like not cool stuff for Dr. Dave? Yeah.
Yeah.
But really.
Oh, yeah. Mima says the coolest memes.
Mima. So is that Italian? No.
It's whatever you want it to be.
It's what Simon can say.
Yeah.
It's Mima? Mima? Papa?
Papa.
My dad's Papa.
Papa.
Yeah?
Yeah, my dad's Papa.
Papa? Evie? That's my niece. He loves Evie.
So wait,
Evie? He wakes up saying, Evie? Evie? We have to like FaceTime her. Or he freaks out.
Who's Evie?
My niece.
Oh, your son says
She's
Evie.
also a toddler.
Got you. Wait, so your wife's sister married your friend?
Yeah.
Oh, that's clutch.
Yeah. So I met my wife's sister at a wedding, I guess now like 9 years ago. They were just dating at the time. And my friend, this is like another frat brother's wedding, and my friend Andy was like, "Oh, can you like take care of my girlfriend for a moment? I'm just gonna like run to the bar or the bathroom or something." So I said something funny to her. I don't remember what, and she was like, "You'd like my sister." Boom. So at the wedding, get on Facebook, and I send my now wife a message saying, your sister told me I'd like you. No pressure.
I'm also here.
Wow.
At this
and
wedding.
the rest is history. Yeah.
That's very clutch.
Yeah.
That is ideal having
How old were you? 10 years ago?
Oh my God.
9 years
she
ago?
would kill me. Yeah, something like that.
26?
Yeah, we'll be married for 5 years in September.
So you dated for 4 years? That's a good number.
Before getting
engaged, or 3 and then
3,
engaged a year.
2 years, something like that.
That's a good amount.
Yeah.
That's a good level. He's almost there.
Low.
I can cut that. Don't worry.
Listen, man, when you know, you know.
Yeah, it's gonna be solidified when we do the family dinner.
Yeah.
That'd be big.
We're gonna do family dinner.
At like an apartment or at a restaurant?
At a restaurant.
With the Famiglias.
With the Famiglia.
Oh, with your parents or just the girlfriends?
No.
It just includes the child.
Just
the boy.
the wives.
Oh, so your boy's coming.
And Simon. Yeah.
He's like very good at restaurants.
We should go to Chuck E. Cheese.
Yeah. That's what he wants.
He would just want to go in the ball pit. Ball?
Yeah.
Ball?
How are you going to deal with like obviously you can't like hide your kid from like fast food, but obviously we don't want our kids eating a ton of fast food. I'm sure you're closer to that than we are, obviously. Like, what's your plan with that?
I haven't thought about it actually. Cause it's funny because I saw someone. I dropped him off at daycare this morning, and when I walked back, I saw like some high school looking kids with McDonald's, and I was like, man, I haven't thought about McDonald's in a long time.
Yeah.
So it's like just not part of our.
No, because once you're adults, you either go like, yes, I eat this all the time, or like, it's really not a part of my life.
But we do like questionably healthy meals with him. Like if we're just like in the mood for something like pizza.
Yeah.
He loves pizza. Pizza's
Pizza's the best.
We're just gonna have like a a montage of me imitating my son.
That's fine.
Hey, we had a doctor on. Evie. That's the whole thing. Of
Pizza.
we learned he's not a great doctor. No, I'm kidding.
Do this.
We can meme you, man.
Yeah.
We could do that.
So what do you think of Adderall? Mima. that would be funny, but it'd be a lot of work. But that actually would be amazing.
No, but he's the one who devours the bread basket at the restaurant.
Oh, I love that.
It's hilarious.
1.5
That's what I
year olds
used
can
to
eat
do.
bread?
What?
1.5 year olds can eat bread?
Oh, yeah.
Is he walking?
Walking and talking, baby.
Walking and talking. Same Mima. Good for him. Damn. Let's see. This is a very random. I always have to have random topics. You know what I think the hardest job in the world is?
Go ahead.
To be one of those ASPCA guys on the street ask for donations. That is fucking impossible. Who the fuck is stopping?
So that's what's that one? That's for animals?
It's for or any of those. You know, those people that have like an orange vest, or they're like, "Hey,
that
can
is
I stop
so-
for 1 second?"
Do you like children? And you're like,
It's like yes.
yeah, I do, but I don't want to talk to you.
Yeah, dude,
Yeah.
it's like I
don't
gotta
wanna talk
go
about it.
somewhere. Dude, I see them
Yeah.
every day, and I'm like, they're always like hustling, and like today I walked by one of them, and then all I heard was like the ASPCA guy being like, "I'm so sorry for your loss." It's like they have to get that down and dirty to like,
Yeah.
get conversation going. It's like I would never want that job.
They always
funny.
camp out outside of hospitals.
Totally.
And they always say they
People are vulnerable.
very vulnerable,
Ah.
but they also pick off people in scrubs. And I wear scrubs to work every day, and I have nothing, like I have no medical degree, nothing. And whenever I walk by these people, they come up to me, they go, "You're a doctor, you like to take care of people." Or
Oh,
you're a doctor, you like people. And I'm like, I'm an oral hygienist and I hate people.
We're like ragging on them, but they're doing a noble thing, I think.
I don't
think the foundations are a little sketchy.
Are they?
Yeah.
But they're also just doing their job. That's more what I am like. Yeah, like they don't want to do that.
No,
These
I don't.
people,
Yeah, I don't think so.
It's just their first job. It's all young kids. Like no, I think those foundations are kind of bullshit.
It is. The opening line is pretty funny. I remember in college, we had this like the business school students could pitch some business idea, and then we actually had storefronts on like campus where the dorms were, and you would like be based out of the storefront for the year.
That's pretty cool.
And then one was like perennially given a license, and it's called Y Down Water, and it was providing water coolers for dorm rooms. It was one of my fraternity brothers who like started it, so it was passed on. And I was a salesman at the beginning of every year, and I had a thing. I was like, "Have you heard about the Y Down Water opportunity?" And everyone was like, "It's like day one of school." And an opportunity?
Yeah.
Tell me everything.
Yeah.
It's where you
Tell
got your
you
gift
what.
to gab.
Yeah.
Take out their notebook.
Yeah.
Yo, so one question before we wrap it up. I'll give you my music. This is my music question. If you've ever seen, I like to throw in a little nice song, and then you're going to give advice to a very specific group of people.
Okay.
Very
Hold
specific. Pygmies in Africa.
All right, Dr. Dave. Pretend that you're speaking to someone who's at the beginning of their, let's say, pre-med, or let's say they even just got to medical school. They got a long journey ahead of them, as you've kind of explained throughout this podcast.
Baby,
What would you tell them
I'm so sorry.
to keep going in this thing? Or like if they're struggling, like maybe they're thinking like, I don't know if this is meant for me. What would you tell them?
I would say figure out what you love. This is
Like you love neurosurgery.
no, seriously. If you are enjoying it despite the rigors, go for it. It's rough, and I don't think it's going to get any easier for doctors. I think our livelihoods are going to be leveled a little bit as time goes on. I don't know if that's a good thing or a bad thing, but
What do you mean by that?
so, there's downward pressure on things to make care more affordable.
I know. Okay, that's what you meant.
Yeah, and there's
Salaries are gonna be lower, you think?
yeah, but it shouldn't matter. You're gonna make an amazing doctor.
Yes.
Our livelihood is always going to be good. We're always going to be needed. That was one thing that always resonated with me, is you're never going to be out of a job. So if you're loving it, if you are feeling like very positive towards the experiences you're having, go for it. It's very rewarding once you are nearing the finish line, and you get glimpses of it. and latch on to people that you want to emulate too. And if you can't find anybody that's in your immediate circle, reach out to people. It doesn't have to be where you're training. I have you make connections everywhere. I was at a course this weekend for something. You exchange digits with people that are world renowned. You always have these opportunities. So seek out the things that you're interested in. Go to conferences. Get involved with research as that tickles you. Get involved in clinical work that
tickles you too.
That tickles you too. I was like, I already tickled you. You can't tickle twice. Man, I kind of, this music makes me just want to keep on talking.
See, I love the talking to the music. That's kind of what made me get in the podcast. I love like hearing like podcast clips over music on YouTube, and I was like, oh fuck, I love that shit.
What is something that you do for yourself when you are at your worst, when you know you got to keep going? How do you get out of that hump, and then how do you move on and keep pursuing the dream?
So I decompress with running.
Oh, great. Yeah, same. I saw your mile times, bro. Yeah, you're fast as fuck.
Sick mile times.
Yeah, it was like 5 miles, and then your pace was like low 7s, I think.
It's more miles than that. Come on.
Actually, maybe it was like 13.
No, I run. I do like a loop. I do like try to do like 6.
But the pace was very good.
I stop whenever possible.
And then you stop.
If there's like it's like green light, that's gonna be yellow soon. I better slow down.
Yeah. Take it off a break. I don't want to.
A little break really does help when you're running.
No, so that's what I do to decompress. I also read a lot of fiction. That's a topic for another.
The Bible? No,
Yeah.
No,
I'm kidding. I'm kidding.
No, I read a lot of I read a lot of fantasy.
Lord of the Rings type stuff.
Yeah, like more like modern stuff.
Yeah.
There's one series that I really loved, The Wheel of Time. It's actually like on Amazon now. They're making a series out of it.
Oh, I saw the commercial.
Yeah. Stuff like that. Just like I read that before I go to bed. Just like I'm a ruminator. So if I don't do something that takes my mind elsewhere, no matter how tired I am, I may be up for hours.
Yeah.
So I found that fiction, like really just, I get transported to like another realm. But I got into fantasy like 4 or 5 years ago, and that's like all I read for fun now.
Yeah, I got to get into reading. Maybe I'll start with fantasy, because I used to, anything with school, pre-K to college, I just, it's school, I'm not into that.
Yeah.
You know what I mean? But now that it's not school, maybe I get into it.
It's problematic because you're forced to read books that are
Huck Finn.
Yeah, I mean, there might be good books, but they're often like, literature is different, I think, than books.
Yeah, no,
way different.
Yeah, it's hard. I mean, there are books that are like touted as like the best books of all time, but it's really hard to read like Dickens. It's really hard.
Oh yeah, it is, for sure it is.
Yeah. You gotta read.
Gotta read more books.
Keep on reading.
Read those books, ladies and gentlemen. Go for runs.
Drink Goldies.
Drink Goldies, go for runs, and read books.
You could actually go for a run after drinking Goldies.
Is there anything in here that
Potassium.
It's got basically every vitamin B under the sun.
Yeah.
Vitamin C. Doesn't have protein, but
This one's got quinine.
Quinine? What does that do?
Fun fact about quinine. Fun fact. This is like the scurvy. Like prevents scurvy.
Oh,
wow. Yeah, they're eating citrus.
They would give, to the semen.
Yeah.
Up to C. I can't do the eyebrow raise.
No?
I think we can, right? Fran can do it really well.
I used to be able to do both, but now I can.
I can just do one. Yeah.
A little.
This is gonna be the like pick.
Yeah, the 3-legged pick.
Drink
we might
Goldies.
as well make the pick how we want to do it. Everyone pose for their camera right now. Look into your camera. Look at that. That's the pick. Hell yeah.
That's a good looking face.
It's a good looking doctor.
That is a good looking doctor.
You ever have a patient wake up, like, oh my God, you're so good looking. No, you have to resedate them. Has that ever happened to you?
It's like, God, they're too sedate.
He's so goddamn good looking.
They should be waking up right now to my looks. What? There's too much stuff.
Turn it off.
You guys.
Have I died and gone to heaven, doctor? Baby.
All right. Wrap it up, boys.
Yeah, man.
Dr. Dave, thanks for coming. First doctor, first dad. 53rd beast to be on the show. Everyone's a beast on the show.
All right.
Glad to be here, boys.
Thanks for listening, guys.
Later.
Doctor.